Good evening, everyone. My name is Ryan Walker, and I'm a surgical technician and a Tier 3 TCCC combat medic instructor. Joining me today is my wife, Bella. She will be assisting me with applying a tourniquet. And before we begin, I just want you to imagine that you're driving down the road with your family, and right as you're about to make a turn onto a busy highway, you're struck by a car that was speeding. This is sadly a tragedy that many Americans will have to face in today's age. And a study done by Allison Jones in October of 2023 showed that it can take 6 minutes for an EMT to get onto the scene of an incident. It only takes 3 minutes for a patient to bleed out. This being said, that same study also showed that bystander aid significantly increased the chances of patient survival when it was applied within 2 minutes of the incident. So today, we'll be using the TCCC slides provided by the military in order to discuss what massive bleeding is and how we can stop it. So first, we must identify what is massive bleeding. Massive bleeding is going to be anything that is just rapid loss of blood. So how you can tell that it's rapid loss of blood is the blood will be squirting, pulsing, or it'll be pooling. So that immediately clues you in to the fact that this person is bleeding a lot. So once you've identified it, you're going to want to put pressure on the area that's squirting or bleeding. Once you've applied pressure, you're going to want to get your materials ready. So you might ask, well, what are the materials that I can use to stop the bleeding? Well, we can use, in this case, a tourniquet, which would be the most likely thing that you would be able to carry in your car. If you didn't have a tourniquet, you just apply pressure, or you can make an improvised tourniquet, which we will cover later. So now we'll begin to demonstrate a hasty, high and tight tourniquet, which will be used in an instance of a car accident when you're on scene with a patient. So most tourniquets that you receive will be in the ready position, something like this, big enough to go over the leg if needed, and it could be applied within a minute, like it says on the slideshow. So for Bella, her arm's bleeding. So you're gonna get the tourniquet, and with this tab right here, which is usually marked with the right tab, you're gonna wanna pull down. You're gonna pull down as much as you can, getting out as much of the slack that you can. Because the more slack you remove out of the tourniquet, the less you have to pull on the torque wrench. After you've pulled as much of the slack out as you can, you'll start to twist the torque wand until the bleeding is stopped. In this case, she's not bleeding, so I would check her pulse, and she has no pulse. So that would tell me that she isn't, or if she was bleeding, she wouldn't be bleeding anymore. Once you've identified that the bleeding has stopped, you would write the time that you applied the tourniquet, and if you don't have a CAT tourniquet, you can use an improvised tourniquet, and you would write that time on their forehead or on their chest, somewhere that's not going to get lost. Most likely they're going to keep their head or their chest. So now we've gone over an actual tourniquet, but what if you don't have a tourniquet? Well, if you don't have a tourniquet, it's a different. But let's say you decide not to. I would use a t-shirt, a towel, or something that is cloth that is going to be thick enough to put pressure on the outside of the walls to compress those arteries in to stop the flow of blood going down to the limb. Now, what I have is a blue towel and a key ring. It's just big enough to fit in this convenient, thick metal pin that I have. So you're going to want to find something that's thick and sturdy that won't break when you're putting a lot of pressure on it. So what you do is you'll slide this ring into position. You'll do like a shoelace knot. So once you've done that shoelace knot, like so, you're going to want to put whatever object is in and shoelace knot one more time. After this, You're going to want to torque down, and this is not going to be comfortable for the patient. But you're going to want to torque down as much as you can until you visually see that that bleeding is stopped. In this case, she has no pulse. Bleeding stopped. So, what did we learn today? We learned how to identify a massive bleed, which is your pulsing, spraying blood that's pooling or soaking into the clothes. We identified how to stop a massive bleed using a tourniquet or an improvised tourniquet. And we identified what to do after. So after you just reassess the patient, make sure that there's no other massive bleeds, and wait for the EMS to arrive on site. All that being said, thank you for your time. I hope you